This is Safe Sex by Cheyenne, Jean, Kelsey, Kyla, Hannah, and Paige. Okay, so safe sex practices, definitely think before you do. Abstinence is the best. Refrain from any sexual activity to prevent any risks. Use condoms from the start of sex to the end of sex to prevent STDs or from getting pregnant. Only have one partner. Tell your partner, talk to your partner. If you do have any STDs, this is something you want to share. Get tested regularly and get your vaccines. Talk to your parents or healthcare provider before about birth control, and definitely if you take antibiotics, double up on contraceptives because you can get pregnant. It counteracts your birth control. And do not use alcohol or drugs before sex because you are not in the right state of mind.
There's many risks and complications whenever you have teen pregnancy due to the young age, low birth weight, and preterm delivery, high blood pressure, which could turn into preeclampsia, greater risk of, how can you say that?
Cephalosport disproportion.
Okay, that's where the baby's head is wider than your pelvic. Single parents, that could put a barrier on financial and other relationships. Keeping balance between parenting, schooling, finances, and relationship could put a big damper on things. Statistics, birth rate of 19 per 1,000 people between the age of 15 and 19 years. Hispanic births rates slightly higher than the rate of non-Hispanic black teens, more than twice the rate of non-Hispanic white teens. 89% of births to teenagers 15 to 19 occurred in unmarried women, and 1/6 of births to 15 to 19-year-olds were to females who already had one child or more.
Okay, STDs. What is an STD? It's a sexually transmitted disease that are most often but not exclusively spread by sexual intercourse. So it can be vaginal, anal, or oral. Some can be spread via blood or blood products. Most common curable by medication are syphilis, gonorrhea, chlamydia, and trichomoniasis. They're curable by antibiotics. Incurable is hepatitis B, genital herpes, HIV, and HPV. HPV is an infection that causes warts in various parts of the body depending on the strain. Genital herpes is a common sexually transmitted infection marked by genital pain and sores. Chlamydia is a common sexually transmitted infection that may not cause symptoms. You can have chlamydia for a long time before you ever realize anything's going on. Gonorrhea is a sexually transmitted bacterial infection that, if untreated, may cause infertility. HIV and AIDS interferes with the body's ability to fight off infections. Syphilis is a bacterial infection usually spread by sexual contact that starts as painless sores. Syphilis, like chlamydia, can also go on for a long time untreated.
All right, so there are many myths about sex, especially among people new to it, as well as the adult population. So the myths pertaining to STIs and oral sex. Some think that you can't get an STI from oral sex, but that's a myth. During oral sex, you can give your partner an STI and you can get theirs. Not all STIs are transmitted through oral sex, but some are. For example, if your partner has a cold sore and performs oral sex on you, you could become infected with herpes in your genital area. There's also some myths about STIs and virginity. Some think that you can't get an STI if your partner is a virgin. Depending on how your partner defines being a virgin, it is possible for them to have contracted an STI. Your partner might not have had vaginal sex, but may have had oral sex with someone, putting them at risk for an STI. And this is a popular misbelief about contracting STIs or STDs from a public toilet seat. And that's in fact a myth. You can get STIs from having sex or by skin-to-skin contact, but not from toilet seats. All right, some other myths about STIs D's. Some ask, can you get pregnant while on your period? So while some just avoid intercourse while on their period altogether, some inevitably like to test this. So it is very uncommon to get pregnant while on your period, but it's possible since having your period doesn't predict when you will release an egg, which has to be present for a sperm to begin the process of conception. So due to the unpredictability of your cycle, if you want to avoid pregnancy, it is important to use contraception, even if you're menstruating. So what can, so there's another question, does peeing after sex reduce chances of contraception? Well, this is a myth. When a male ejaculates, the sperm travels through the vagina into the cervix and then into the uterus. Urine is released from the urethra, not from the vaginal opening. So it does not come into contact with the sperm. Definitely you can get pregnant. Anyway, next question. Can you get pregnant if you're a virgin? So some think that they haven't had sex before, so they're unlikely to be fertile. This is a myth. It doesn't matter if it's your first time having sex. It is possible to get pregnant. Abstaining from sex altogether is the best way to prevent pregnancy, but if you decide to have sex, condoms and other birth control methods can help prevent pregnancy. Next.
So, resources for dealing with STDs. We're all in high school, so school nurses are there on campus and they're readily available. They have the knowledge and they can answer any questions. You've known them for a while, so you're pretty comfortable with them. And they can also help you find the resources in the community. Counselors at the school also. It's kind of emotionally trying to get an STD, so if you find out you have one or you suspect you have one, it's going to be very emotional. We're all teenagers, so our emotions are crazy anyway. So they can help. STDs can be scary. You don't know anything about them. So they understand. They're not going to judge you. They're going to be able to help you get through just the emotional aspect of the whole process. And in Batesville, because this is local, we have the health department. They do free testing. They do free education for STDs, and they do medication. So if you go in, you get tested, it comes out positive, they can give you medicine. The staff is welcoming, and they don't want you to feel ashamed or unwanted. They want you to come in and get help. They want to prevent the spread of the diseases. They have education and preventative measures. If you are going to be sexually active, they will give you condoms so that you can hopefully reduce the chances of getting one. And then their number and their hours are listed, so just stop by if you think you need them. If you have any questions, you can call. No one's going to know.
These are our references, and we thank you for watching.